Swipe down. Nope. Double tap flip camera. Chill. All right.
Yo. I don't think it's live yet.
This one needs to be this way, huh? Go like this.
All right, we're live.
Go ahead.
Let's do it. All right. So what we're gonna do is answer questions that people have asked as far as the subscriptions. But feel free to ask whatever questions. We'll address whatever questions you guys post right here. So first question is from Justin Ranker. What is your preferred exercise for ankle flexibility, specifically for keeping toes more forward when squatting? So as far as your ankle flexibility, there's two main things. It's either going to be your soft tissue as far as your gastroc and your soleus muscles, or it's going to be that talocrural joint itself. So a quick test that you can do is just being about 4 inches away from the wall and making sure that your knee can touch the wall. So what I like to do, 4 fingers. Yeah, it's about your hand width. So what I like to do specifically for warming up for this squat is doing some kind of exercise like this on an elevated surface where I can get leverage and making sure that my knee gets over my toes and making sure my foot doesn't pronate. So I keep my foot, what I like to do is drive that knee outwards and really stabilizing my foot right here. Yeah. And you can do that for about a minute or two before, and you'll notice that you'll get a little more ankle dorsiflexion range of motion.
All right, so as Raj said, thanks for tuning in. We'll focus on the live questions as we get them on the comments, either through Facebook or through Periscope. And then we'll answer the questions that you guys have either asked us in comments or direct messages right now. I'm not even in the screen, I just realized that. But go ahead, next one.
All right, so here's a question that I got from Henry. This might be too long or specific for a public Q&A question, but what do you recommend as a treatment of patellar tendonitis? It's difficult working out my quads because of my knee pain, so I feel like very easy things are not effective. So Henry, you're not alone. This is a question that we've been getting a lot, especially in the past month. We've been looking forward to addressing this question. And this is actually a good time to bring up the fact that we're going to be doing a new post called Flashback Friday. We actually have a ton of old content that could answer a ton of our questions that we get. So if you check out our episode number 3, it's about how to treat tendonitis in general. A rule of thumb, what you want to do is you want to start out with isometric or eccentric strengthening. So again, we're going to be posting that video later. It's episode 3 if you want to check it out now in the meantime. But specifically for patellar tendonitis and other tendonitis, you want to do isometric strength training as well as eccentric strength training. Continuing to do concentric strength training is just going to continue bothering the problem. And then also, if you're doing squats, this is typically where people complain of tendonitis or anterior knee discomfort. So one thing that you want to do is when you start with your squat, whatever joint moves first is going to be predominantly loaded. So if I start here with a squat and my knees start going first, I'm loading my quads up more versus if I start with hips, my hips are going to be loaded more dominantly compared to the quads. So if you're working towards a hip exercise, you want to move with the hips first versus if you want to unload the quads, you want to push the hips back versus the knees going forward first.
All right, 2 questions from IG. One of them was on the video we posted yesterday, the skaters, from KMOSC001. He or she said, for the drill, do you think it's appropriate to use TheraBands as a regression rather than a progression, with the goal of being to create some reactive neuromuscular training for valgus correction on landings? And 100%. I know in the video that I posted yesterday with the band, we were using it more for a strengthening drill. But 100%, if you had a low resistance band, you could use it for some RNT, and it'd actually be more of a regression because it would help somebody prevent valgus when they land. Another IG question that we got, I think it was a DM, was from Manderson 1990. He said, what do you think of the functional movement screen? Do you use a similar screen when performing evaluations? I know none of us, you could say use the certified FMS, But basically, any PT should be doing movement analysis, should be doing essentially what the FMS measures. That's what any good PT should be doing. The FMS is good in that it's a standardized assessment. You look at only these, five, I don't know the whole test off the top of my head, but these 5, 6, 7 things.
Yeah.
There's scores for it.
When I did training during my year before I started PT school, and I took bits and pieces of the FMS screen. But honestly, you don't have to do the full exact screen. I mean, of course, people do it. It's a hot commodity, especially in the NFL, like the Indianapolis Colts. They do it with all their NFL players before, during, and after the season to get full scores, and then they're crunching those data numbers to see, were those players actually more vulnerable to injury? Did they get an injury? And are there different ways to change that and avoid those? So taking bits and pieces of it are great for screening, but you don't have to do necessarily the entire thing every single time.
Mm-hmm.
It's good that's looking at function and quality of movement, so that's good.
Yeah, so next question is from Marcelo Cuenca. Do you three gentlemen do workshop courses, and do you treat private practice? So we currently are still students, like we said before. So we don't have our license, so we can't treat pain technically. But we do mobility consultations where we kind of look at your movement, kind of see how you're moving, and kind of can address the impairments that you present with, or if you have specific PRs that you want to hit with your exercise training, or just want an exercise regimen in general. We do offer things like that. And then another question is, what's the best way to trigger teres minor eccentrically by Thane Widman? So teres minor is one of the rotator cuff muscles, as we mentioned before, and it's an external rotator and horizontal abductor of the shoulder. So basically what it's going to be doing is this. So what you want to do is do that motion for that muscle to be activated. We did a series earlier this week where we kind of talked about some plyometric exercises that take you through that range of motion. But what a common misconception is, what people do at the gym that I've seen a lot that Mike posted as far as what not to do, is just have a weight right here pulling you down. This is basically activating just your bicep. What you want to do is lay sideways. You want to lay horizontal. That's how you're going to actually activate. Yeah, so we'll show you. So when you're going right here to right here, you are going through your external rotation range of motion. However, you're mainly activating your bicep. What you want to do is more go into that horizontal position and go in like this. This is now activating the external rotators. What you can do, what I like is for just like a general warm-up of the rotator cuff, is to activate and go through that whole range of motion of scaption and external rotation. Just like that. That's going to basically get all the rotator cuffs, especially that teres minor that you're asking about.
Okay, let's go to the next question. So, from Aaron Swanson, what are the best ways to explain how to hinge at the hip when bending over? And, for example, promoting an anterior pelvic tilt for a Romanian deadlift or bent over row. So this is a great question. I'm sure the three of us can all agree trying to teach a client or a patient how to hinge at the hips can be tricky. Great ways to do it are just setting up an external blocker. And by that, I physically mean if I stand here, if this chair was a little bit higher and I could block my knees with it, I'm literally going to tell the person, put their hands on their hips. Yeah, that's a good way to do it. Put their hands on their hips and just practice moving like this. A lot of people will do this, or they'll still go down with their knees first, but really getting something to push the hips back. Even getting, if you stand behind me and pull with this band around my hips.
Mm-hmm.
This is a great way to teach someone how to hinge at the hips as well. What you want to do is, if Arash pulls with enough resistance, this will just help me hinge at the hips. But in order to get a good hip hinge, the trunk has to move as well. So I can't just do this and still stand up nice and tall, because that's just going to lead to an anterior pelvic tilt. So now for bent over row, you said that you want to promote an anterior pelvic tilt. However, too much of an anterior pelvic tilt is not good. That just means that you don't have good core control. So, for example, with a Rosh, if you stand facing that way.
Scoot back a little bit.
Okay. So, Rosh, get over into a bent over row and get into a good neutral position. Now go into extreme anterior pelvic tilt. So, if you can see, he kind of arches here versus trying to tuck all the way like posterior pelvic tilt. So he's flexed here, and that's not good either. So what you want to do is you want to stand back up, stand up. So do like real anterior pelvic tilt too, like arch. So if you can see, like all the erectors are just like way on right now. There's this huge curve versus do like extreme posterior pelvic tilt. Now he flexes a little bit. I'm trying to go into neutral. So you want to go into neutral, and now what you want to do is you want to do that hip hinge. No, too much anterior pelvic tilt. You want to go right into the hip hinge and hold that while you do bent over rows, Romanian deadlifts. You want a neutral pelvic alignment. You want neutral spine, and that'll be better. Yeah, go ahead. Wiggle your butt, Arash. So that's what you want to do. If you're doing heavy bent over rows or Romanian deadlifts with too much of an anterior pelvic tilt, you're actually not activating your core muscles and you're not getting anterior trunk control. And that can lead to injury, overuse, or a tissue strain.
I know we got a question on IG2. Are we going to do a sacroiliac joint dysfunction series? It's something we considered. A lot of it is manual therapy based.
Yeah.
So I don't know how appropriate it would be for our page. Just a couple exercises I can think of on the top of my head that we can do. One thing we wanted to ask you guys is Instagram came out with like the stories. We don't really know how we want to use it at this point.
Yeah.
But if you guys have any suggestions, let us know. I think we've just been posting a lot of insights on what our daily lives are. We just took our last final today, which is awesome.
Especially in our last year of school.
Yeah.
And we had
really
donuts
awesome
this morning, so that was all over the story. So we gotta go work those off later. I know I do.
All right. Next question. Let's do the shoulder mobility one.
Okay.
So from Haider Ali Hashmi, basically says shoulder mobility and stability for overhead lifts. So first thing you want to have is that shoulder overhead mobility, obviously. If you don't have the mobility with the proper stability, you're going to have to compensate to get in that position. So the two common limitations as far as the stability or the mobility is your lats and then your pecs. So we've had a series on this before, but we can show you a quick example here. Craig, stand up, of how to stretch the lats. So if Craig was a wall, let's say, just standing right here, and I want to stretch my right lat, what I want to do is go ahead and go into full shoulder flexion with external rotation of the glenohumeral joint, and then make sure to keep this pelvis posteriorly tilted, basically tucked under. And then if you want to add that last little bit, you can also rotate away. This is really stretching out this whole lat area right here. And then as far as a pec stretch, if Craig was still my wall, if I want to stretch this left pec, what I'd want to do is basically stabilize my elbow right here, and I can kind of twist away and really open this whole area up from the pec to the anterior deltoids. And if you are getting some neural tension, which some people may from doing this, you can just lower your arm, or you can even just bring your shoulder on that wall and just rotate away right here. And this will also get more pec minor the lower you bring your arm.
And we just got a question on the Periscope. I think you answered it earlier. What's the plan for after school? I think all of us are did we answer that? All of us are considering some form of course, continually learning, whether that in whatever form that comes in. I think at this point it's a little too early to know.
Yeah,
but
we would like to take on some private clients potentially, but we are primarily focused on our education as well and getting continuing education with whatever specialized field we're trying to get into. Orthopedics. I know Craig's interested in neuro.
Yeah, we have 32 weeks left of clinical rotations, and Mike Rosh and I were kind of all over the place. I don't know if you tuned into the last Q&A, but Mike will be in China for 4 months this spring.
Oh yeah.
Rosh is going to be in orthopedics during the fall and spring. I will be in Northo. I will be in
Ortho? Is that what we
Nor-
call that?
Northo.
Ortho?
Actually, that's a great.
That's a
little
wannabe
term.
ortho.
Yeah.
Wannabe
I'll be doing neuro. I'll be doing neuro in the fall, and then ortho in the spring, and then Mike, you're going to get some neuro in the spring as well.
I don't even know. I'm going to China for 4 months, basically part of a team bringing PT over to China. And essentially, I don't really have any more information besides that. I know I get to work at the Olympic Center at I think the nest that they built there for the Olympics in 2008 in Beijing. There's a lot of different sites I'm going to. I really don't even know. I heard some powerlifters, a lot of motorcycle accidents, so that'll be the neuro.
But that's going to dictate a lot for us. I think all three of us can agree that how our clinicals go, what we get exposed to, what we see we work well with, and what we kind of really like and don't like as much is going to dictate what we want to pursue right after school and, what we're going to take on. I think that wraps it up, though, right?
Mm-hmm.
I think so.
All right, so thanks for tuning in, guys. I hope that this was a better Q&A. We were trying to stick more to the point this time. Please give any feedback, suggestions, concerns, anything and everything, because we enjoy doing this, and this isn't going to be the last time.
Yeah.
All right.
Let us know, too, what you guys want us to use a story for, and then the IG story. And then we will be putting out that Survey Monkey that we said about last time.
Yeah.
I think it's 4 or 5 questions just letting us know how to improve with the content we're delivering.
Yeah. Feel free to ask any other questions you guys got. We'll try to do this as often as we can.
All right. Thanks, guys.
All right.
Chill.